You talk about cancer being, tying it to holistic. Explain what you mean.
Well, there's
there.
there's a homeopathic doctor in India. His name is Ramakrishnan. All he uses is homeopathy. He doesn't do vitamins, he doesn't do nutrition, he doesn't do diet. He just does homeopathy. And he has 52, 65, 72, 80% success rates with all different types of cancer. Abram Hoffer, who was a medical doctor, bless his heart, he was a colleague of Linus Pauling, the vitamin C guru.
Mm-hmm.
Hoffer founded a type of medicine called orthomolecular medicine, which is kind of like naturopathic medicine, but it's the use of vitamins therapeutically. Hoffer and Pauling had remarkable results with cancer patients, right? Dr. Wallach, when he was working at the cancer clinic in Mexico, because the holistic therapeutics are outlawed in the United States, was having remarkable results with cancer. Nobody had developed a cure for cancer, but their therapeutics were much more effective than drugs and surgery and chemo. Much more effective and clinically verified and published. But it's not looked at because medicine in the United States is a for-profit industry. In a perfect world, if by some genie in the bottle magic, we would all wake up tomorrow, and from tomorrow forward, there would be equal disbursement of money for medical research amongst all the professions. The chiropractors would get 50%, and the naturopaths or 20%, and the naturopaths would get 20%, the homeopaths would get 20%, the acupuncturists would get 20%, and the MDs would get 20%. In about 5 years, most MDs would be out of business because their therapeutics do not work. I want you to think about this. Of the thousands of prescription medicines that there are, the only prescription medicines that cure anything are antibiotics. Medical doctor, MD, can cure pneumonia, they can cure bronchitis, they can cure staph and strep, and they can cure parasitic infections, right? But that's it. But medical doctor can't even cure heartburn. They don't cure heartburn, they manage it. They can't cure arthritis, they manage it. They can't cure high blood pressure, they manage it. They can't cure fibromyalgia, they manage it. And so forth and so on. But because this is the only thing that we've grown up with in the United States, because this is all that we know, the only doctor that we know about is the MD doctor, and the MDs have been telling everybody and their brother for the last 100 years that I'm a quack, and that all my colleagues are quacks. The American Medical Association was found guilty in federal court in 1984 of promoting a 10-year slander campaign against the chiropractors. And they were ordered to pay the chiropractors $25 million in damages for slandering them for 10 years. And we give them a pass. We give that profession a pass. They kill 15,000 Medicare patients a month, and we give them a pass. They've lost the war on cancer. We give them a pass. When are we going to wake up? It's time. That's why we give 400 free lectures a year. That's why we're generating a giant grassroots network. And quite frankly, the listening audience here, we need your help. We need your help because we're dying in this country for no good reason. And the irony of ironies is that we know the solution. But nobody's listening. That's not true. People are starting to listen. And this word is spreading. We have a number of churches in North Carolina and in South Chicago that the pastors of the church have had health problems, and they've come to Dr. Wallach and myself and recovered their health, and now they're telling their congregation, and the congregation is adopting our policies and recovering their health, and it's starting to spread like wildfire. So we are getting a little bit of lift here. But I think it was Max Planck, who was a physicist, one of Einstein's colleagues, right? And Niels Bohr. Max Planck said medicine progresses, or science evolves one funeral at a time, right? Because the old guard believes and practices what they've been trained in, what they're invested in financially, emotionally. They're not going to, no, people are not open to new ideas. So, you know, we're at the very beginning of a new thing here in the United States. And hopefully with the use of media, you know, we can populate our message faster, better, stronger, and more effectively. Because as God is my witness, for most of the conditions that most people go to the MD for most of the time, the MD is completely unable to fix it. You cannot fix a nutrient deficiency disease with a drug. Now listen, if you got a bullet in your arm, or if you've broken your leg or in your automobile accident, that's what those guys are good for. Go to them for that. And in China, where they have 2.5 billion people, they don't have a healthcare crisis. Why? They don't have skyrocketing healthcare costs. Why? They don't have people filing bankruptcy because of health issues. Why? Because they only use Western medicine. They only use MD-directed pharmaceutical medicine for trauma. For everything else, they use acupuncture and herbs. Tip of the iceberg here in the United States. So we've been, again, I don't want to say brainwashed, but I can't think of another word. It's not brainwashing. Enculturated. We've been enculturated to believe that the MD knows everything that there is about medicine and everybody else is a back-of-the-bus quack. And quite frankly, it couldn't be further from the truth, because the only people selling snake oil in the United States have MD after their name. The only people selling snake oil in the United States have MD after their name.